Good afternoon, everyone, and thank you for joining us today at our media briefing this November the 15th. Time marches on as we're getting closer and closer to that big day, Christmas. I'd like to welcome Dr. Elizabeth Richardson, our Medical Officer of Health, and Jason Thorne, our city's Emergency Operations Center Director. And before we get started, I'd like to highlight that Hamilton Day is happening this Saturday, November the 20th. Hamilton Day is a one-day shopping event encouraging people to get a jump start on the holiday season by supporting local businesses and local shopping. So when you support local business, you are supporting local friends and neighbors, people that own businesses and work in local shops. All of them could use your support when you buy local. That keeps the employment going and keeps the businesses in business. So please join the Chamber of Commerce, who has created this great initiative to have a one-day, November the 20th, Hamilton Day, local shopping day. So to visit hamilton.ca for more information, please do. You'll get more information there on everyone that's participating. As things slowly open up, more of us are out and about again, and that's a good thing, and I know we all feel good about that. But at the same time, our cooler, rainy fall weather means we are spending more and more time indoors as well. So that is why it's important everyone continues to follow the public health guidelines. And they are continuing to monitor for symptoms. Stay home and get tested if you have symptoms. Continue following public health practices such as wearing a mask or the physical distancing and the hand washing. And of course, carry your proof of vaccination to access the select indoor public spaces, restaurants, cafes, and gyms. And, my own experience has been that is working very, very effectively and very smoothly. Everyone seems to be prepared to take your vaccine verification QR code and or additional information from your health card to verify your vaccination, whether it's a restaurant, a gym, or theater, or others. I have had no difficulties in accessing or providing that information, and it's all very quick and speedy. So please continue to do that, and thank you for your cooperation for not giving those that are asking for it a hard time. I also want to underscore the continued importance of getting vaccinated. And, the vaccine policies are in place while we are phasing out of this pandemic. That the province will be potentially lifting the requirements, and I think it's unfortunate that they may have indicated that, and that'll be dependent upon where we are in terms of COVID, and as we might get some indicators today that things are going up as opposed to going down, that certainly may be prolonged for some time if that is the case. But that in no way diminishes the importance of getting the vaccine. So in fact, it is more important than ever before we are able to stamp out this virus once and for all. It'll be critical for everyone to get the vaccine. So if you want to protect yourself and your family, get the vaccine. If you want to protect others that you work with and associate with in your work environment, get the vaccine. If you want to keep our community open and keep those restaurants and businesses doors open so that we can get freer access to them without any major restrictions, get the vaccine. It is still so very important. So if you haven't spoken to your healthcare professional, please do. And the doctor, I'm sure, Dr. Elizabeth will advise as to where the vaccine clinics are and how easy they are to get to and how convenient it is to get vaccinated right now. So, but on the Emergency Operations Center side, what's open, closed, and what any challenges we might be seeing in our city, we have Jason Thorne to share that information with us. Jason?
Thank you very much, Mr. Mayor. And I do have just two updates this afternoon coming from the Emergency Operations Center. I'll start with an update on the city's vaccine verification policy for city employees. So this past August, Hamilton Council had approved a mandatory COVID-19 vaccine verification policy, which requires all city employees to either provide proof of 2 doses of their COVID-19 vaccination or participate in the city's COVID-19 rapid testing program. That testing program began on November the 4th and has been running quite smoothly, with just over 500 employees collecting the kits they need to participate in the program. In early November, we had shared some initial numbers regarding staff who will be placed on unpaid leave because they were not compliant with the policy. The city had originally expected approximately 317 city employees to be placed on an unpaid leave. I'm happy to say that number has considerably reduced and now sits at approximately 89, with just 24 of those being full-time city staff. So that is just 1.2% of the city's workforce, meaning that overall, 98.8% of the city's workforce are currently compliant with the policy. I also want to provide an update to the public on the plans for returning some of those city workers who are currently working remotely back into the workplace. With approximately 2,100 city staff still working from home due to the COVID-19 pandemic, we're now sharing plans for how we'll begin to return those staff back to the workplace, in some cases under more flexible work arrangements starting over the coming months. Back in September, we had shared our Hamilton at Work plan, which considers new ways of working, including more flexible work arrangements in some cases, so for some staff to continue working from home or in a hybrid working model. Late last week, we hit an important milestone as we shared information and details with our staff about our return to the workplace plans. At a high level, beginning the week of December the 6th, directors and general managers who are currently working from home will commence a phased and gradual return to the workplace under their selected Hamilton at Work model. All remaining staff across the organization who are currently working from home will commence a phased and gradual return to the workplace beginning the week of January the 10th, again, under the approved Hamilton at Work model. And that return effort is expected to take place over the course of a number of weeks. We do have some smaller pockets of staff as well, such as in the Planning and Economic Development Department, who will be returning to the office even sooner, beginning early next week. For now, this is just for staff returning to the workplace. We're not announcing any new reopenings of city offices for access by the public or city counters for access by the public, but we will be sharing more on that in the coming weeks. So with that, I will turn things over to Dr. Richardson.
Thanks very much, Jason. So I've got some numbers, of course, as per our usual practice here today. And so you will have seen, of course, the modeling that was released by the Ontario COVID-19 Science Advisory Table this past Friday, and seen that many regions in the province are actually seeing their COVID-19 case trends increasing. In some notable areas like Sudbury did actually have to step backwards as well in terms of their COVID-19 controls because of the worrisome increase in cases. And so just a very important lesson back to what the mayor was saying earlier, that we all do need to continue to be vigilant, to monitor what is going on and practice those public health measures, as well as get vaccinated as we're continuing to learn how to live with the COVID-19 virus. Overall, here in Hamilton, our case activity has just maintained a sort of consistent level. We have 25,462 cases now that have been reported, a net change of 32 cases from Friday. Our activity levels stay highest amongst those that are 0 to 59 years of age. Our 7-day moving average number of cases is at 13, and the weekly incidence per 100,000 is at 15, with our most recent updated weekly reproductive number sitting at 0.95. Our hospitalization numbers are also low, very low at this time, less than 1 new hospitalization each day, and the average number of deaths occurring per day is also very low. Test positivity, while lower than we've seen in the past, is higher than we would like to see it. It's sitting at 1.7%. And we still do have 9 active outbreaks, 4 new ones having been reported today, and all the details on those outbreaks can be found on our COVID-19 dashboard. As I mentioned earlier, these trends can change quickly. We've seen it where we had a rise a little earlier than other parts of Ontario earlier in the fall, and then subsequently we've seen our cases level off now, and seen increases elsewhere in the province, and people are monitoring those very quickly. We do know as well, of course, that the province chose to pause the reopening that would have happened today and wait a further 28 days to see where the trends are going as we go forward. So keeping our guards up is crucial. We need to do our part in order to help slow the spread of COVID-19, to protect those that can't be vaccinated. And of course, that includes children under the age of 12, who we are waiting very closely for any news on when a vaccine may be available for those 5 to 11 years old. But still those 0 to 4 as well. Vaccine does seem to be sometime in the offing for that group. And of course, there are community members who either can't be vaccinated or whose response to vaccination isn't as good as those of us who are healthy. And so we're doing this to protect them as well. And of course, remember on the public health measures front, as the mayor said, if you're sick, stay home, hand wash frequently, really make choices about what you're going to go out and do, how many people you're going to see, manage the level of contacts that you have, and try to reduce those in order to keep your number of contacts low. On the vaccine front, 85.7% of Hamiltonians now have chosen to be vaccinated, with 82.4% fully vaccinated. Our healthcare partners here in Hamilton have administered over 874,000 doses of vaccines here. Earlier today, you'll have seen that we are one of a few health units in the province so far that have published our COVID-19 vaccine coverage rates in local schools. As you know, publishing our data as soon as we can onto our website is a strong part of our commitment to transparency and of sharing relevant and timely data with our community, as we've done long before the COVID-19 pandemic and through these last 18 months as well. Now, these school vaccination rates that we have published today are a snapshot as of October the 25th and include students who are eligible for a COVID-19 vaccine who live here in Hamilton. For privacy purposes, we did not post vaccine coverage rates for 8 schools, and that's because in those schools there are only a very limited number of students who are enrolled, either equal to or less than 10 students that were eligible and enrolled in those schools. The vaccination rates were confirmed by linking together the COVID-19 vaccine records from the province's COVAX database and the local school board's enrollment lists through our Panorama database. In total, the analysis included about 38,000 COVID vaccine eligible students at 169 local schools. What we've seen in this data, as we've gone throughout this pandemic, is that COVID-19 vaccination rates appear to correlate with the socioeconomic status, the social determinants of health. And this is what we've seen, as I said, for our case rates. We've seen this with our vaccine rates overall. And we also see this in similar ways when it comes to other vaccines that we monitor. And you'll know that we publish vaccination coverage rates for those vaccines that are required under the Immunization of School Pupils Act. And those are also up on the web. Now, the other thing to remember whenever you publish rates by schools, it is not a reflective at all of the school's performance. It is rooted in the determinants of health around those schools, in the communities around those schools, in terms of those vaccination rates. These vaccination rates mean that we have every tool working for us when it comes to support COVID-19 case, contact, and outbreak management. So they are utilized in looking at the level of dismissal in schools and which students can stay in the class. And as well, it provides us information that we use in planning the vaccine program and our last mile strategy as we go to move forward. Our top priority in the vaccine strategy continues to be first and second doses of the COVID-19 vaccine. It offers very powerful and potent protection, and it's very persistent. And ensuring neighborhoods and school communities with lower coverage rates have access to the information that they need. It's tailored to their needs, and that vaccine that is accessible and convenient in terms of its location and its time. So we are going to continue to provide mobile clinics two clinics each day, 7 days a week, in more consistent and predictable locations to offer community members more steady and consistent service. And over the next 5 weeks, and as we enter into the holiday season, we're also going to be launching 5 in-school COVID-19 vaccine clinics at the 5 secondary schools that have the lowest coverage rates. So these clinics are going to be available to Hamilton Wentworth District School Board and Hamilton Wentworth Catholic District School Board students, their families and staff in each school community, plus any eligible students from elementary feeder schools. The rates that we published today are also being used in the planning for the anticipated eligibility expansion to children who are 5 to 11 years of age. And as we talked about today at our Board of Health meeting, we do work with our partners at the local school boards, along with McMaster Children's Hospitals, to scale up operations in preparation for these children. And this includes, of course, family-friendly clinics and an age-specific vaccine confidence campaign. As always, you can find all of our information, whether it's about COVID itself or about the vaccine clinics and our operating hours. They're regularly updated on the hamilton.ca Get Your Vaccine page. And just to note as well, we are continuing to accept walk-ins for any of our first and second doses, and any third doses that are required do require people to book in through the Virto platform, which can be found through the link on our website. That's it for me, Mr. Mayor.
Thank you, Elizabeth, and thank you, Jason, for that all-important information. We must be mindful of the active role we all play in keeping our community healthy and safe. We need to think of ourselves, but also think of others in order to ensure the health and safety of patrons accessing indoor and outdoor venues. So, as we all know, Hamilton has a lot to offer in terms of sports teams, talented musicians, local shops, bars, restaurants, cafes, and so much more. So let's continue to support local businesses as they implement that proof of vaccination policy that I think is working exceptionally well. And the vast majority of our businesses and venues out there are doing exactly the right thing, and we encourage them to continue to do so. With that, I'm going to turn it over to Jasmine. I'm sure there are some questions from the media, should they be here. Jasmine.
Thank you, Mr. Mayor. We have just 2 media partners joining us today, and as usual, we will start with 1 question and 1 follow-up for each of you. First question will be to Samantha Craigs from CBC Hamilton. Samantha, you can go ahead.
Thank you. My question is for Dr. Richardson. I listened to your presentation at the Board of Health this morning, and you talked a little bit about how we were going to have to pivot at some point to learning to live with COVID, how this is just going to be a thing in our lives. And I was wondering if you could say more about that, if you could elaborate on how we're going to do that, because I think that's kind of where some people are at or how they're feeling about it already. So yeah, can you just elaborate for me?
Absolutely, Samantha. Thanks for listening in this morning and for asking this question today. I very much think that's actually what we're in the process of doing right now. And so we are trying to understand how much vaccination can do for us and the control measures that we need to take, the public health measures that we need to take to keep the rates of infection down. And of course, most importantly, keep people from becoming severely ill and hospitalized in the ICU or even dying from COVID-19. And so we're stepping through this as we go forward, understanding on the vaccination front how many doses are needed in order to maintain that protection. And at the same time, how much of the control measures are we going to need given how well the vaccine is working so that we can keep our kids in school. You know, that's been one of our #1 priorities as we've gone through this process. Keep our businesses functioning, keep our communities functioning, keep people being able to get together and get together even more so as we go forward. And so we're working all that through as we go. We're going to continue to need the science that we are having generated by all sorts of people, including our science advisory table. And we're going to continue to need the patience of the community as we walk through this process and see what works. The worst thing would be if we end up in the situation that we've seen other jurisdictions have happen when they proceed too quickly in a particular direction, and then they have a large increase in cases, you know, significant impacts in terms of people getting very sick and significant impacts on their healthcare system, which then means if you're sick with anything else as well, your chances of getting treatment at that point of time are challenged. And so we're very much looking to move through this slowly and continue to learn as we go and figure out how we do live with this all together.
You also mentioned this morning that other jurisdictions are sliding backwards, but Hamilton's doing okay. What makes us different?
You know, that's the question that many of us ask, Samantha, as we go through this. And we've certainly seen some of the bigger patterns that help us understand that in terms of, vaccination coverage rates, the degree to which public health measures are being followed, and the impacts that we see across the country more so demonstrate that. When we're looking at particular places in Ontario, because overall within Ontario, we have really quite similar vaccination rates across the province. There are, of course, some pockets of communities that don't have higher vaccination rates, and those are the ones that you often hear Peter Juni from the Science Table being very worried about in terms of, these are areas where we can have the virus get into those areas, spread in those communities, and we've seen that in Hamilton previously as well. And so I think it's a matter of just seeing how the virus continues to wind its way through. Some places where people, may not be following measures as closely as they should, and we certainly continue to see that as part of the explanation. And so you're seeing particularly, areas where you're going to be with not wearing your mask, where you're more physically active. Those are going to be the kinds of places where there's more concern. And so we're seeing that happen and play out in communities across Ontario.
Great, thanks, Dr. Richardson. We'll go next to Joanna from the Hamilton Spectator. Joanna, you can go ahead.
Hi, thanks so much for the question today. My first question is for Dr. Richardson. Dr. Richardson, when looking at the school-by-school vaccination rates, there is clearly hesitancy within the religious private schools, particularly the Christian schools. Was that something that was on your radar before? And what is being done to reach out to those schools or to reach out to that community?
Yeah, thanks, Joanna. That's certainly a pattern that we do see, that some religious groups have their own ideas about vaccination and how they choose to handle that, whether that's related to a practice amongst a group of people or a religious actual background that dictates practices in that way, that varies. But we have been reaching out. We reach out to those groups all the time when it comes to our vaccination program regularly. So we're connected with those schools, with those communities, and have worked things through in the past when we've had other infectious diseases that have had outbreaks, like measles and the like in the past. So as we work through this time, absolutely, we find that there are outbreaks that have happened amongst these communities. It gives us a chance to talk with the elders, the leaders in those communities, and talk through, the importance of vaccination. What are the control measures they can put in place? What do they need to feel comfortable with making the choice around vaccination, or how they're going to continue to use control measures as they go forward? So very personal decisions that people are making, and we know different people make choices for different reasons. But these are definitely communities here in Hamilton and across Ontario, and indeed across Canada, that public health agencies have been working with to help them with those questions.
Thanks so much. And my next question, you talked already about the socioeconomic drivers of health and how you can see that in these numbers. It's very stark. Can you talk a little bit about, sort of what you're seeing when it comes to that with these school-by-school vaccination rates and what you're able to do about that? Like, is there more you can do than simply bring the clinics to those communities? Like, what is it that you can do to help combat that?
Yeah, it's very much similar to what we've been doing throughout the vaccination program in terms of working with the communities where this is the case. So there is work we've done with groups, whether they're racialized groups or, again, religious groups. And we've had some tremendous work with some faith leaders that has gone on. We work with physician leaders as well that are parts of those communities. And of course, our vaccine ambassadors are out doing outreach all the time in these various communities where we have lower coverage rates. So there's a lot of work to be done. It is a combination of answering questions, working through issues that may face those communities in particular, or questions that they have, or history that may be there, and as well making sure that the vaccine is available to those areas at convenient times, in convenient locations. And definitely it's a commitment over time that is really required in order to build that confidence and have people have the time and the ability to get in and get vaccinated.
Great, thank you, Dr. Richardson. We still have time, so we'll go back to each of you for 2 more questions each. So first to Samantha, you can go ahead.
Thank you for the extra questions. I was also interested this morning in the map showing where people are vaccinated. And I noticed that there are actually parts of Flamborough where about 54% have 1 shot. I was wondering if you could speak to what's happening in those areas.
Thanks, Samantha. Yes, again, that is where, we do see these variations. And when you see and talk to people in various areas, there are a number of reasons why people may not be vaccinated. So again, that piece in terms of, thinking it through, what are the challenges they face medically? What are the challenges they face in terms of transportation or information or language that they may want to, they may need the information to be conveyed in, and getting a chance to get to a clinic in those areas. And so doing that work by the CT site was very important to us. So we made sure we weren't missing anything when we did it at the higher level, the FSA or forward sortation area level. We found that we got a lot more nuances in terms of where the pockets were, where people were not yet having the vaccination rates that we're seeing in the rest of Hamilton. And so we've had some very concentrated groups, our clinic teams that go out and do the mobile clinics in all of these census tract areas that have had the lower vaccination coverage rates. We've been very pleased to see they have definitely been catching up on first and second doses at a faster rate than the rest of Hamilton. So they are making up that ground. We've been working, of course, as well with the ward counselors, particularly out in the Flamborough region, to talk about, where are the best places for the clinics? How can they get the word out? How can they support the vaccination campaign? So all of those have been really important to get those rates up.
So just to clarify, geographic isolation in Flamborough has been an issue then for people.
Sam, it's hard to say whether it's geographic isolation per se, but certainly we want to make sure it's not a barrier in terms of geographic isolation. And so having the clinics go out in, well into Flamborough and working with, as I said, the ward counselor, the community about where's the best sites for those clinics has been a key part that we've been doing to try and make sure that that's not a barrier.
Thank you.
We'll go next back to Joanna. Joanna, you can go ahead.
Hi, thanks so much for the extra questions. My question's for Dr. Richardson. Dr. Richardson, have you seen a correspondence with cases and outbreaks in schools and these school-by-school vaccination rates?
Thanks, Joanna. We haven't yet done a piece of analysis to look exactly at how those outbreaks and those vaccination rates are correlated. Certainly what we did see when it came to the outbreaks was when kids came back to school, yes, we saw the case numbers go up. We saw the outbreak numbers go up. We did see them begin to come back down, and we do see higher rates of transmission in our elementary schools where, of course, there are far less pupils who can be vaccinated. Rather than our secondary schools where there are, of course, more people who can be vaccinated in that 12 to 17-year age group. And, big kudos out to them as well, because they've brought those vaccination rates up very quickly in our teens that are being vaccinated. So definitely see the correlation in that way. School by school, we haven't yet had a chance to look at it that way. But definitely, as we've gone through, we would definitely have seen coming back together, being in closed spaces being a factor for it. And again, we saw a little rise as well that happened after the reopening in the beginning to middle of October. We saw a bit of a rise in cases again around November 1st. So I would say the larger issue overall in terms of school cases has been that transmission in the community. The schools continue to reflect what is going on in the community and the level of contact that we're having with one another and the degree to which we're following public health measures as we're moving forward.
Thanks so much for that. My next question is for you too as well, Dr. Richardson. When it comes to the religious private schools, are you finding that the adults in these religious communities have similar vaccination rates to the kids in the schools? And how big of a concern is that to have sort of these pockets of unvaccinated in Hamilton in the face of the Delta variant, which we have been told likes to spread in areas where, unvaccinated are grouped together?
Yeah, thanks, Joanna. The vaccination rates of the staff we don't have. We only have the vaccination rates of the students because that's the information that has been made available to us. So as we go through and we look at our cases overall, we do know that we still, as a province, tend to see our cases most amongst those who are unvaccinated or partially vaccinated. And that, of course, is our greatest concern, is making sure that people do get their vaccines. It reduces the likelihood of a symptomatic infection. It reduces the length of that illness, so it makes them less likely to shed for as long. The virus that could be transmitted to others makes them less at risk in terms of severe disease, hospitalization, ICU stays, and death, of course. So vaccine is absolutely critical as we go forward.
Great. Thank you, Dr. Richardson. Mr. Mayor, that's the end of our media questions for today. We'll go back to you.
Great. Thank you, Jasmine. And thank you to our media partners for tuning in and asking questions. Hopefully they'll share some additional information with the folks in our community, and to Bill Custers and the entire team, Cable 14 and Clear Cable. Thank you so much for your ongoing work to put these great information sharing opportunities together. And for more information, for those of you that want or need more information on COVID-19 financial supports and any of the updates, visit our website at hamilton.ca/coronavirus. All the information you need about it can be found there. And as the doctor pointed out, continuing to follow all of our public health measures and getting your vaccine is still the most important thing to do today to keep our community and ourselves and individuals safe. So if you haven't spoken to your medical professional, please do go to a reliable source and get the vaccine at your earliest convenience on a myriad of locations throughout the city, including some 100 pharmacies across the community that are participating in the vaccination, as well as our formal vaccination clinics in various locations. One of them newly at the Limeridge Mall for your convenience. So all of that's available, and that certainly should make it easy for you to get your vaccine. If you want the latest information on that, hamilton.ca/coronavirus again, or by following us on social media. Thank you for tuning in. Hopefully you have good days as the weather changes and the fall is upon us. And we look forward to talking to you next time, but that is it for today. So thank you. We'll talk to you soon.